Mastering injections, anatomy, and techniques. Injections are a cornerstone of nursing practice, essential for administering medication, vaccines, and therapies. Understanding the anatomical principles underlying injection techniques is vital for ensuring patient safety and effective treatment. In this presentation, we will explore the anatomy relevant to injections, the various types of injections, best administration practices, and potential complications that may arise from anatomical errors. Injections can be categorized based on the route of administration. The four primary types are intramuscular, IM, subcutaneous, subQ, intravenous, IV, and intradermal, IV. Intramuscular injections are administered directly into the muscle, allowing rapid medication absorption. Common sites of IM injections include the deltoid, vastus lateralis, and ventrogluteal muscles. The typical value limit for IM injections ranges from 2 milliliters to 5 milliliters, depending on the site. Administering an IM injection into the wrong muscle can lead to inadequate medication absorption and ineffective treatment. These injections are often used for vaccinations, hormone therapies, and antibiotics that require deeper tissue absorption. The deltoid muscle, located on the lateral aspect of the upper arm and innervated by the axillary nerve, is commonly used for IM injections, particularly for vaccinations like influenza. These muscles can accommodate small values of up to 2 milliliters. However, injecting too high in the deltoid poses a risk of injuring the axillary nerve, leading to weakness in the shoulder abduction or sensory loss in the lateral arm.
So the next slide I talk about deltoid muscle. Deltoid muscle is a large triangular-shaped muscle that lies over the glenohumeral joints and which gives the shoulder its rounder contour. It is comprised of three distinct portions: anterior or claviculate, medial or acromial, and posterior or spinal. As mainly as an abductor of the shoulder and stabilizer of the humeral head, as well as assist the forward elevation. The deltoid is a very powerful muscle and is used in many ADLs. ADL is an activity of daily life. For examples, is carry in shopping bag, washing hair, and many athletic activity, for example, swimming, water polo. The next slide I talk about IM injection size. What does lateralis? IM is intramuscular คือการฉีดยาเข้ากล้ามเนื้อค่ะ The first is located in the anterior lateral thing innervated by the femoral nerve. 2. Advantage preferred from infants and children, allows for large volume up to 3 ml. 3. Technique inject at a 90-degree angle, aspirate to shake form but returns. 4. The risk mistaken injection into the femoral nerve can cause motor defects or paresthesia. The next is varus lateralis is located on the lateral side of the thing. This muscle is largest of quadriceps, which includes rectus femoralis, varus intermedius, and varus medialis. Together, quadriceps are on the knees and the hip to promote movement as well as strength and stability. They provide power for and they absorb the impact of daily activities such as walking, running, and jumping. The next is IM injection site ventrogluteus muscle. The first is located in hip regions, comprises gluteus medius and minimus muscle. 2. Safety. Consider safe side due to things muscle layer and lack of major nerve. 3. Volume. Ideal for RAS volume IM injection up to 5 ml. 4. Patent ranks. Prepared for adult and children over 7 months of age. So the next slide is ventral gluteus muscle. Ventral gluteus refer to the gluteus medius and gluteus minimus muscle are highly safe injection sites, meaning they are free from injection complications such as fibrosis nerve damage, abscess, tissue necrosis.
Talk about subcutaneous injection, or we can call sub-Q injection. Let's start with definition of sub-Q injection. It is medication administration into subcutaneous tissue between skin and muscle. The anatomical layer of sub-Q injection are loose connective tissue and fat beneath dermis above muscle. The upper right hand, you will see a picture is about common site. There are abdomen, outer thigh, and back up upper arm. The volume limit of sub-Q injection is 1 to 2 ml. And the last one is common medication. There are insulin, anticoagulant, and some vaccine. And the last picture, you will see a picture about subcutaneous injection angle. At two types. The first type is 90 degrees angle and the second type is 45 degrees angle. Let's get to know the subcutaneous tissue. Subcutaneous tissue is the deepest layer of the skin located under the dermis. It consists of adipose tissue and connective tissue. It performs several important functions such as shock absorption, energy storage, temperature regulation, and the last one is adhesion and connection. And next, we talk about the structure of the subcutaneous layer. You can listen to me and see the picture on the right hand for more understand. First, it contains mostly adipocyte and contain blood vessel and lymphatic vessel to nourish tissue, and also contains some sensory nerve. The next type is intravenous injection, or we can call IV injection. Direct administration. IV injection delivers substances directly into the brainstem for immediately effects. IV injections is used for emergency medication fluid and some chemotherapy agents. The length of IV injections is incorrect placement can lead to extravasations, causing tissue damage. Common sites of IV injections are peripheral vein in arm, including cephalic, basilic, and median cubital vein. It is about interbrachial vein, or we can call intercubital veins. Actually, the most common injection method is through the vein in the arm, such as the intercubital veins, wrist vein or hand vein. Interbrachial veins is a vein in the elbow area that connects to blood vessel on either side of the arm. It is often used for blood draws for medical tests or for IV fluid administration because it is usually light and easy accessible.
For intradermal injection, the definition administered into the dermis layer just beneath the epidermis. Anatomical consideration, the dermis contains a rich network of blood vessels and nerve endings. For the technique, The needed is angle at 15 degrees for site lab information. And the last one is application, used for the allergy test, tuberculosis, screening, and some vaccination. Injection technique and best practice. The first one is preparation. Practice house hygiene, use aseptic techniques, gather appropriate equipment. The second one is site selectors. Consider patient age, body mass, and medication being administered. The third one is injection angle. Vary by type, 90 degree, 45 to 90 degree, 10 to 50 degree, and 50 to 30 degree. And the last one, post-injection care, monitor for adverse reaction, provide education and acceptation. Next, we're going to talk about the human skin layer. The human skin layer have three main layers. The first layer is epidermis. This is the topmost layer of skin. It is divided into several layers of cells. The epidermis contains cells called keratinocytes that produce keratin, which help protect the skin from the environment. The second layer is dermis. Created beneath the epidermis, it contains blood vessels, nerve, hair cells, and cells as fibrous that produce collagen and elastin, which help skin stay flexible and in shape. And the last layer is hypodermis or subcutaneous tissue. This is the deepest layer beneath the dermis. It contains aqueous tissue and blood vessels that store energy and ACT as cushion from the body. Next is complication and management. Local reaction, plain swelling and redness at the injection site are common. Systemic reaction, allergic reaction, or anaphylaxis require immediate intervention. The last one, prevention. Proper technique and infection control measures are crucial or prevent complication. And the last one, conclusion. The first one, anatomical knowledge. Understanding injection site anatomy is crucial for safe, effective medication administration. The second one, continue learning. Go on in study of human anatomy, enhancing patient care and clinical skill. The third one is patient safely. Proper technique and site selection minimize complication and improve treatment outcomes. For the last one, professional developments, mastering injection techniques and is a fundamental skill from nursing practice.